Hey guys, welcome back to my channel. I'm Sukriti. I hope you guys are doing well. And today we're going to talk about PMS, premenstrual syndrome, PCOD and PCOS, that is Polycystic Ovarian Disorder. These two terms are very common among women these days, primarily because 75% of women do suffer from one or the other type of premenstrual syndrome. That one of every 3 women go through things like bloating, abdominal cramps, excessive pain, acne, migraine, nausea every month before their ovulation. So all these conditions I just mentioned are known as premenstrual symptoms. Now when we see all these symptoms along with things like irregular menstrual cycle and along with some other pathological reasons, that could be formation of cysts in the ovaries, then that is known as PCOD or Polycystic Ovarian Disorder. Then these symptoms, which were previously known as premenstrual symptoms, now change to Polycystic Ovarian Disorder. So now what are the various causes of this condition? These could either be genetic or environmental. Environmental factors include your sedentary lifestyle, your unhealthy diet, your irregular sleep pattern, or it could be stress. All these factors contribute to creating hormonal imbalance in our body, which may lead to PCOD. So now coming on to how do we get diagnosed for PCOS and PCOD. Number one is the symptoms. When there is a hormonal imbalance in the body, that is the amount of androgens increase slightly or in excess and the amount of progesterone and estrogen decreases, that is when the body creates a hormonal imbalance, and the symptoms are quite evident. We can say immediate acne, we can say abnormal hair growth, we can say there's a weight gain, we can say irregular menstrual cycle. That is when we get to know that we have symptoms for a condition which is known as PCOD. The second method of diagnosis is by doing biochemical test or ultrasound scans. So not going into very much detail, when we get an ultrasound scan over the periphery of the ovaries, there we usually have 20 small follicles, but when there is this disorder, the follicles increase and we can see cysts on the periphery of the ovaries. So that is when we get to know that we may have condition known as PCOD. Now the lesser known fact is that PCOD is only of one type. It is not true. PCOD is basically divided into 2 categories, which further gets classified into type A, B, C and D. So that will be a lot of more medical terms. So we will not go into details of all the types of PCOD, but the 2 major classifications are classical PCOD and non-classical PCOD. So basically the classical one is more common and it is more seen in obese people, whereas the non-classical one is more prevalent in lean people. That means yes, lean people can also get PCOD. So there's a myth busting here that not only obese person but lean people also need to take care of their lifestyle so that they do not get PCOD. Now another question that comes up here is that can PCOD come back once it's treated? That is totally true, because it's a chronic lifestyle disorder. So only when we create a sustained healthy lifestyle, that is when we can control the disorder, otherwise it can surely come back. Now what could be the possible risk factors of PCOD? These includes cancer of the uterus, this includes hypertension, this includes diabetes and many other cardiovascular diseases in future. Apart from this, if you have any questions related to PMS or PCOD, please drop them down in the comment box. I'll try to answer all of them. See you in the next video.